You're watching Talk with Audrey. Nearly 100 million Americans experience chronic pain. It's a largely misunderstood condition. But because September is Pain Awareness Month, we're going to be talking a lot this month about opioid-free, non-pharmacologic treatment options for people with chronic pain conditions following an injury or trauma. It's often called complex regional pain syndrome, or CRPS. My guests today are Dr. Corey Hunter, an interventional pain specialist at the Ainsworth Institute of Pain Management and assistant clinical professor at Mount Sinai, and Doug Rodd, a medical retired U.S. Army paratrooper from the 82nd Airborne, who damaged both his knees after many years of active duty. Hi.
Thank you.
Hello.
Let me start with you, Dr. Hunter. What is chronic pain? You hear a lot about pain, but no one really seems to understand it.
So broadly speaking, chronic pain is any kind of a pain that lasts longer than 6 to 8 months. What makes it so difficult to treat is that over time, the pain may not be coming from the same place anymore. So when it sticks around for 6 to 8 months or longer, the pain may be coming from someplace else. So what may have started out as something as simple as like a sprained ankle or a broken arm, after that period of time, the pain can move and can be coming from someplace else. And since we don't really have any way to kind of pinpoint where the pain is coming from, we don't really know where to focus the treatment. And that's what makes it so difficult.
So the pain can go anywhere. Wow, I didn't know that. I thought it was localized. So that's something new. What's complex regional pain syndrome?
So we usually abbreviate it CRPS, and it's something that not a lot of people have heard about unless they're unfortunate enough to have it or know a family member that has it. And we don't know a lot about it, or as far as like why one person will get it and one person won't. People who have it will sometimes call it the suicide disease because they'd rather not go on living than have to deal with another day or an hour of dealing with such excruciating pain. And the reason why it's so frustrating is because it can start off as something as simple as just a really innocuous injury or going for a routine surgery. And then the body heals from the injury or the surgery, but the pain continues and it just progressively gets worse and worse over time to the point where you can't even use that affected limb anymore. So
you're talking about just absolute misery with no end.
That's right. So, I mean, traditionally, we really haven't had a whole heck of a lot to treat this. We would rely on medications and, basic nerve blocks, but the medications are traditionally very limited. We just, have some, nerve pain medications like gabapentin and Lyrica, which are, not that great for this. And the nerve blocks, if they work at all, they don't last that long. So we often tend to turn to opioids pretty quickly for these patients just because we want to give them some resemblance of relief because the pain is so excruciating. And then, what happens is because the pain is so bad in this particular group of patients, the amount that they need is so much more than the average patient. So we're talking about tolerance and then dependence and potentially addiction.
Right. Doug, you had some injuries that you sustained when you were in the military, and the pain then was as a result of those injuries. Would you tell us about some of the challenges that you experienced?
Well, they started young. I was a young fella, and I had some injuries when jumping. Subsequent surgeries. Ultimately, it led to an early knee replacement. And while the knee replacement was a success, the last knee replacement that I had, I was left with a condition where that nerve in that left leg just would not settle down. And consequently, the swelling in that leg was just unbearable. And the constant throbbing and the pain to where I needed all types of medication just to make it through the day.
Wow, it must have really impacted the quality of your life.
Oh my gosh, that's understated. It affects every part of your life.
Well, how was your pain treated originally?
Originally, once it was diagnosed as complex regional pain syndrome, then we used pharmaceutical intervention. I have used all types of opiates. When it was at its worst, it was fentanyl. And more recently, in the last, say, 5 years, it was primarily morphine. I had gotten to a point where I was using morphine with other things. I also had a spinal cord stimulator and would go for periodic injections in the spine.
You must have experienced an incredible amount of pain to have been through all those treatment options. Dr. Hunter, there are new treatments and new therapies that have nothing whatsoever to do with drugs. Why don't you tell us about it?
That's right. I mean, you also punctuated the big portion of this. There's no need for medication with this. So what we're using now is really the first of its kind therapy. It's called the Abbott DRG stimulator. And for the first time, we have a proven and effective treatment for chronic pain, particularly CRPS. And again, for the first time, I really can look my patients right in the eye and tell them there's a really good possibility I'm going to give you your life back and you're not going to need medication anymore. And in a nutshell, the way it works is very similar to a cardiac pacemaker, which is something everybody's very familiar with, where it uses electricity to make sure that the heart's beating correctly. In a similar way, we use this to send small electrical impulses to the nervous system that the patient can't feel, and it alters the pain signals. And what makes it so truly unique is we can focus this on one particular body part. So like in Doug's case, the knee or the foot. Maybe you had someone had an amputation and they have phantom limb pain. This is something we've never been able to treat before. Groin pain from something as simple as a hernia repair, pelvic pain where patients can't sit. We can focus the pain and concentrate on that one particular area and deliver, really life-changing treatment for these patients.
It's a device that's implanted?
It is. So the way we do it is it's a test drive. It's a trial. So patients can get this, they test it out and they see there's no cutting, there's no scars, there's no incisions. They really just try it out and see if, we as doctors are delivering on our promise that this is as effective as we think it's going to be. And if it is, then we put this device in permanently just like a cardiac pacemaker and just like in Doug's case.
Well, how is it monitored and set? I would assume that it has to be tailored to each patient. So how does that aspect of it work?
That's right. I mean, that's another thing of what makes this thing so effective and so truly unique is because it is completely tailored to every single patient. It's not a square peg and you're hoping that the patient's a square hole. And the way it works is this particular device uses Apple technology, so you can actually interface with like an iPod Touch. And it uses the batteries. You don't have to recharge them. They last for about 5 to 7 years. And whenever the pain changes, the person can they go in and have the device programmed to kind of match that whatever little change happened to their pain in the interim.
So Doug, is it working for you?
Oh my gosh. That is a great question, and I'm going to get pretty bubbly about this, but I had the Abbott DRG stimulator implanted the day after Thanksgiving, and I have to say that by the second week of February, after 10 years of using all types of morphine and opiates, I have not had a single dose of any pain medication. So it is life-changing, and as Dr. Hunter said, give me my life back.
Oh, but you're not sprinting though, right?
I'm not sprinting, but I did walk 3 miles last night with my wife.
Wow, that speaks volumes. Dr. Hunter, who's a candidate?
Basically, anybody who's been suffering from chronic pain, at least 6 months of trying conservative therapy, and we're talking about basically like focal nerve pain. So in addition to things like CRPS, phantom limb pain, we're using it for patients with pain after surgery. We're using this for certain types of pelvic pain. And the way you can find out more about it to see if you are a candidate is go to the website aboutyourpain.com. You can learn more about Abbott's DRG stimulator, learn about the conditions we're using to treat it, and most importantly, there's a physician finder. So you can put in your zip code and find a pain expert in your community who's trained in the DRG stimulator and make an appointment and see if you're a candidate for it.
Where can people go for more information, Dr. Hunter?
Sure. Go to the website aboutyourpain.com. It'll tell you about the Abbott's DRG stimulator and help you find a physician in your community that's trained in it.
Thank you both for joining me.
Thank you.
Thank you.